welcome, good morning. Yes, modifications and punts, but in the life of caregivers and people who serve caregivers, we definitely know how that goes. And our hope for today is that we re-energize everyone in this room to reimagine how you serve underserved populations and underserved communities in your state, whether it is African Americans, Native Americans, Hmong, those living in rural communities, LGBTQ+, grandparents or other relatives raising grandchildren. It is really, or children and families in crisis, it's really essential that professionals really are concise and conscious in their efforts when they're doing outreach and efforts with underserved populations in their communities, because those often are the ones that go under the radar and don't get the services that they need. We originally had La Movida, the first Spanish-speaking radio station that was going to come on stage today. We have Hector Portillo and Araceli Nord from Padres, Hijos, and Accion in Madison. They're going to come and share a little bit about their organization in a bit and how they're serving the Latino community in Dane County. They do some really great things and they partner with RCAW. We love working with them. Pat Gallagher and Lanette Hansen are here from Magic 98. They're a radio station in the Madison area. They were going to be here anyway, broadcasting their show in the hallway, but we called them yesterday when Lupita Montoto from La Movida was unable to be here and said, "Can you actually come on stage and help moderate?" And poor Pat was like, "Excuse me?" But they have really great energy, and it's gonna be great. So first, what I would like to do is welcome Pat Gallagher. Lanette, you're coming now while Secretary Timberlake's doing her interview. So welcome. And then we'll have Hector and Araceli. Would you like to come up? Or whoever, yeah. Then that should be on. If we need another mic, Margie has one.
We want 2 people more.
Oh, you want, yeah, whoever.
The more the merrier. That means the less I have to talk.
That's what you want.
Hello,
yes.
Margie,
Hello.
can I have the mic?
No.
No.
Not, unfortunately. That's where Lupita would have been able to.
I know.
But then, that's how I'm sorry. Well, once again, welcome everyone to the 2022 National Lifespan Respite Conference. I am Pat Gallagher from Magic 98. Going to have the panel here introduce themselves. I want to start with the far end of the table because she needs to jump out for just a minute here. So who are you?
Every morning we spend together and we're still working on names. My name is Lanette Hansen. I am the other half of the morning show on Magic 98. I do love that everybody's talking about punting so much because that's what Rachel and Lisa talked about. They said, this profession knows how to punt. Your profession knows how to punt. Together, we get at least one touchdown. Something in here, you know, the ball goes through the goal.
And then we can jump around.
Yes, yes.
You will truly know what it's like.
So all together, here we go. So these are extremely important people here. And because of that, I want them to introduce themselves. I'm going to go do an interview on the radio with Karen Timberlake, who you just were listening to. And then I'm going to give this microphone to you. Do not be scared of it. Pass it on down. Introduce yourself, say what you do, and then continue on down the line, all right? All right, I'll scoop back in here when we can.
Good morning, my name is Hector Portillo. I'm the director of Padres, Hijos, and Accion. It's a non-profit organization working with families with members with disabilities. Thank you.
Good morning. My name is Araceli Portillo. I'm the co-founder of Padres, Hijos, and Accion, and I'm Hector's wife.
Buenos días, mi nombre es Concepción Rueda y soy de Respire también.
So her name is Connie. She took recently the respite training with us through organization Padres Hijos. We'll learn more about that later. I just wanted to translate for her. She is now able to provide respite services in the community. Well, thank you for having us here. My name is Araceli Nord. I work with Padres, Hijos, and Accion, and I'm the bilingual family advocate. And thank you again for having us here.
Nope, no, I've got
That's
mine.
mine? Okay.
Now it's yours. You can share it throughout there. So once again, the theme behind this first breakout session is all about respite and reaching out to underserved communities and serving them better. That would be Hispanic and Black and Brown and Asian and all kinds of different populations that are maybe underserved as far as respite goes. We're going to do a little bit of a Q&A with the panelists, but we invite any of you to jump in at any point and raise your hand, jump up and say, hey, wait a minute, I got something that makes a whole lot of sense here, or I got a question about what you just said. Anytime you want, please feel free to do that. I woke up yesterday with no voice, so talk about punting. Let's talk a little bit about respite in your individual communities here. Clearly, different communities handle challenging situations differently, whether it's an end-of-life situation or a special needs family member or a serious illness or injury that takes more resources than the average family has on hand. What's the most important aspect of respite care in your particular communities? What's the best thing you can offer people as respite care providers?
Well, as we all know, respite it's a break for a caregiver. We're all caregivers here at the panel, and I'm sure among the audience there are also caregivers. What we try to provide our families within our organization is offer trainings so they could have a better understanding of what respite involves. Oftentimes within our community, we have parents that feel a little bit uncomfortable with having someone other than their own family members to come to the home and provide that needed respite for the parents. So we as an organization, we try to let the parents know it's okay. You can have someone to help you. You need the help, you need the rest. And thank you to the Respite Care Association of Wisconsin for that wonderful basic respite provider training. It's been a great tool that we have used as an organization to help those parents know more. They will know what to expect from their providers, from the respite care providers out there, and they will, once they take the training, they will feel more comfortable to help each other and to provide that needed respite for one another. We are grateful to be here, and I'm gonna have Connie Rueda. I will be translating for her to share her experience. She took the training with our organization, and we are here so she can share her experience. What did she feel like when taking the training? ¿Lo puedes decir en español? ¿Cómo se sintió?
Pues la verdad yo me sentí muy a gusto. Al principio me sentí un poco nerviosa porque era pues la primera vez. Pero como yo soy cuidadora de niños, quise, o sea, metí un poco de lo que es de niños con la niña y me fue muy bien. Ella se portó muy bien. Ella me dijo que con una mano me decía sí, otra no. La verdad la experiencia para mí fue muy bonita haber ayudado por primera vez a esta muchachita.
So she was very happy she took the training with us. She's a childcare provider, and her first experience when providing respite services after taking the basic provider training with our organization was great. She worked with a little girl that has a disability. She's in a wheelchair, and she is able to use like sign language to communicate with her. So she will raise her hand to say yes, and she will lower her hand to say no. That was a fulfilling experience for Connie. All right, so now I'm gonna pass the microphone to Araceli Portillo. We We have a lot to share. We just want to try to have our minds open to try to, if we forget something, the other one will catch it.
Well, thank you, Araceli and Araceli. So thank you. There's another way that we provide respite in our group. First, I want to mention to you if in our community, that is the Latino community, sometimes moms, we feel like we're selfish if we don't take care of ourselves, and we spend more time with taking care of our kids, and then sometimes we forget that it is important to take care of ourselves too, in a different ways, mentally, physically, because it's very important that a mother to feel, to be happy, to be relaxed, and that is a very important part of respite. So it was in the month of May that we made a pampering mom, that is consintiendo a mamá. It was another form to let them know that be relaxed, it's okay. And in this event, we provide different services for them to pamper them, o consintiéndolas, that it was making their hair, haircut, makeup, nails. I know it sounds so fun, huh? And the brown, and also therapy. It was a therapy, and also relaxation, because mental health is something that we have to remember that is very, very important. It is a whole. It's a big part of a whole, and we need to pay more attention to that, especially, as I mentioned before, Latinos, moms, they don't want, as Araceli mentioned, even leave the kids in charge of somebody else, because they feel like, oh no, bad mom, what if this happen? So we following a lot of steps to help them to, and Hector probably is going to talk more about the profile that we are creating for the families. But also, during this Consintiendo a Mamá, there we have a very nice photos about that. We also provide healthy food, because it's another part of taking care of us. In physical activity is another part, but because not in this event, we did not provide physical activity in this event, because obviously they want to look nice and not sweaty, so it's either or. That is what the reason why physical activity was not part of this event. But we provide healthy food, hummus, vegetables, quinoa salad. It was something real good that they can go while they're waiting for another service to go and eat, and then talk, socialize. That's another one that we provide too. So if you have any questions about this event, or let me know. Okay, so I'm gonna pass the microphone to my husband.
Finally. You know, it's hard to be next to a woman. Yes, but I'm happy with that, so, because they are making excellent work. So thank you to Wisconsin Respite Care Association. They provide grant to us. This pampering mom and other respite activities are possible with these kind of grants. So I can do that alone, and this team did the work. 1,000 hours to planning, and also set together 25 volunteers and contractors to serve 35 families plus some other staff. So look, we're planning for 2 hours, but we must extend to 5 hours, because a lot need for our families. You can see in the future when I share the face of the moms relaxing, and they asking for more. So, well, let me see if we can get more grants. Because and we need to adapt, to tailor those activities to the Latino community. It's like easy, for Latino, but we are some most of the time in the shadow for our kids. There's no respite providers in the community. Is why we start our training for respite care. So we graduate 11 people or person finished the training, and we are starting the second cohort or soon for more people. We have outreach 6 or recruit 6 people more. So our goal is to provide or training most people as we can, because it's a need. A need is the first concern of families when asked, what do you need? Respite. Please respite. Now everyone knows COVID put in a hot spot our families. Yeah.
Thank you so much. So Araceli was translating our respite care provider training in Spanish to individuals in their communities so they could go through the 10 courses. And we can't thank you enough for doing that. But what I'm really excited to announce is on September 20th, the respite care provider training has been translated into Spanish. So it will be available on our website. So we would still love for you to train people in person if you would like to and do the translating. But thanks to Val, our training and development specialist, and a grant, and those who we contracted with at UW Oshkosh, we're really excited because this is something that we've been asked about and how to break down the barriers. And a lot of the times it's language. So we're extremely excited to announce that.
I just wanted to add real quickly, for those of you that are participating in the pilot project for the national training that we're doing, because we got this 5-year grant from ACL, we are just about completed our Spanish translation in language, not just the flip the switch translation, so that it's actually meaningful and intentional. But we have enough money in there to translate all the state-specific slides into Spanish, so you guys who are participating don't need to do this on your own. We're going to provide the core programming in Spanish, and we have the monies to translate your state-specific slides as well.
We've been talking a lot about respite within the Hispanic community, and I'm assuming that this is probably the case with all the underserved communities. You mentioned towards the end of what you were talking about that there are not a lot of respite providers within your community. And I would think, and I don't know if this is a fact, but I would think that that would cause a little mistrust when someone like me tries to come into your community and tell you how to do things. Is that true? Is that a problem as well?
Well, yes or not.
Okay.
First, communication is a barrier always. It's mostly it's misunderstanding the concept, the vocabulary. Sometimes, but obviously we are aware for everyone. So we need to create the relationship first in order to bring someone to take care of our kids or child. So this is a working process to integrate our community in the whole community. It's why sometimes we invite another speaker with an English speaker to come to share their expertise with us. However, it's not, our families prefer someone to speak in their own language. They prefer the training in their own language. This is why Araceli North and Padres, Hijos, and Accion do the task to translate everything. So now with the materials in Spanish, it will be more easy for us. And I forgot to mention before something. We're talking about pampering mom and the health, mental health for the mom. But what about the fathers? What happened with the men? So we are machos, so we need help. So we also did something for the fathers, but just 5 show up. So because there's still a lot to work. We need a lot of work to educate the fathers, the male. Today also need be in shape in the mental health and the physical health. So this is part of the we as a father. She mentioned it. Don't trust another. The fathers are a little more. I don't know. I cannot do it. But it's not because something wrong with the people. There's something with miss a little more communication, a little more education, a little more information. What's the goal?
Yeah, I think that being in, let's talk a little bit about Padres, Hijos en Acción. I think that have Hector as a leader, it is very helpful for the organization because then, going back to the culture, sometimes the males, they don't want to get too involved. And sometimes they think that it is the job of the mom to take care of the kid with special needs. And sometimes they're there just to kind of cheer the mom and say, you're doing a good job, but bye, it is your job. And then we can see that in the group, and more fathers or males are getting involved, which is real nice and also helpful for the whole family and the community too. So when we thought about consintiendo mamá or pampering mom, we also go like, well, we don't have a big number of males, but we need to also include them. See, because we always talking about inclusion, so this is a way to include them. And then they were very happy, at least 5 show up, but they have a really good time being together. And I think that's a very important for the males to know that they're a very important part of this team as a family who take care of a kid with disabilities.
Yeah, thank you for, I feel like all of the things we're sharing, a lot of you and the audience are familiar with, and please, like Pat said, feel free to raise your hand and share your experience or ask questions. Something that I missed mentioning earlier, one of the things we noticed within our community is there no, language is not the only barrier. We also have the cultural background, and we also have the technology barrier. One of the reasons that we provide the training to our families in a one-to-one basis or directly or in a group setting, it's because a lot of our families are what we can say old school. They don't feel comfortable with computers and they need a lot of assistance. We've been happy to count with help with a couple other bilingual volunteers and had provide a lot of help to the participants to take this training. Leslie, if she's there somewhere, thank you so much because she's been a great help to us. Every time we got participants and got locked out of their accounts or whatever, she's been available even on weekends to help us out. So thank you. And I'll pass it on to Hector, I guess.
Looks like we're going back this way.
Yeah, thank you, Araceli, for mentioning the technology part. So I'm going to mention Respite Care Association. They provide 40 tablets 2 years ago to our families when they struggle with the Zoom. They use some of their own computer to use the Zoom. However, it's a lot of work with the families to teach them how to use the computer. So they know how to handle the Zoom meetings for everyone. They don't need any more the tablet, but they use their own computer. But thank you to Respite Care Association for this tablet. They provide the families the open the door for learn how to attend all those meetings and the school and other one. So in the future, we're planning to provide a computer or basic computer for families. They can attend or take any kind of training they wanted. So, but this is still a process. When I say most of the families are old school, and they need a little more information about how to handle the computers. They navigate very easy Facebook and other kinds, but they don't know how to navigate the internet for trainings. So, thank you.
The theme of this entire conference is to reimagine respite. COVID forced us to reimagine a whole lot of our lives. Our jobs changed. Whatever your job is, it changed during COVID. A lot of that was a negative, but there were some positives that came out of that as well. We learned how to serve our communities in different ways. I can use it as an example. I'm on the board of directors of the River Food Pantry, which is a huge food pantry here in Dane County. And we had to change the way we did everything like instantaneously. It went from almost a shopping experience where people could go in and pick out their own groceries to suddenly we can't let people in this building anymore. And we had to turn it into a drive-through experience and then an online ordering experience. And these are things that are being carried forward and have made the whole experience better for the people who are served. How in the respite industry, do we call it an industry? Is that the right word? How in respite care has COVID changed what you do? And what are some positives that have come out of that? I know there's negatives, but what are some positive things that you're able to take forward in the things you had to adjust from COVID times?
Oh, okay, so we don't have to.
Yeah, you don't have to pass all the way down.
Well, I don't know about you guys, but I feel like the negatives are pretty elevated right
Yeah,
now.
I think the
when you
negatives
about
outweigh,
respite.
but
So we noticed it for most of our families, even therapies for their children got suspended or canceled due to COVID. So if you think respite, obviously that stopped. A lot of providers stopped coming to the homes due to COVID. So those are the bad, we know. So I will say the good things could be that we as an organization, we still work through COVID. We follow the DHS protocols. We had our participants for workshops to wear masks, and we still welcome. And we started the training when COVID was in the middle, I would say, of it. So they had a little bit extra time, I would say, to take the training. That's the only thing I can think of a positive outcome. They had time to be able to access that training.
I want to speak about the positive things. Always we talk about negative things, but the positive things is going to hear. Because Wisconsin Respite Care Association provide grants to support families, but also there's an organization come aboard like a BPDD is one board for people with development disabilities, always open to everyone of every community to support us in our work, and also another community like a White Man Center. We expect this is the positive thing for our community. We are not alone. It's when I say yes or no to don't trust the other communities. Yes, and yes, we trust because they heard the feel or they are trying to support us. However, the communication, the barriers, this always be there. So it's not because you have a good intention to do the work. You can go directly with the families. You need to first know about the culture, know about the families, create a relationship. And this is the positive thing. All these agencies, organizations approach to us to support to us because we can do that alone. So this is the positive thing. Obviously, we can spend hours talking about negative things, but always I need to point, we are a team. Wisconsin, this very strong, very welcoming every people, open to support each other.
We would like to ask the audience who would like to share, what are you doing in your state or wherever you live to support an underserved community? What is a success story that you have? What is a barrier that you have? What is something that you've overcome? We'd really love to hear what's going on across the nation. Don't be shy.
Well, good morning, everyone. I'm Aisha Stevens from Oklahoma, and we actually have a breakout session, and we're going to go into more detail, but I'm also Kiowa. My name means your daughter in Kiowa. I'm a family caregiver, blessed with 4 children, and our oldest has significant disabilities. We have an awesome team, truly dedicated to family caregivers. We're intentional about trying to reach underserved. We actually have a respite bilingual coordinator, Myra Castaneda. I won't make her stand, but she can wave. No. We have Talina Ford, who from our state partner. And I love the comment earlier. Lisa said something about feeling like a hot potato and I found home. honestly, I can say that about our partnership from, our state partners to the community partners. We recognize we've got to do better at reaching underserved family caregivers. Our application is translated in Spanish. Everything that we put out, from a community event to program information, is all translated. We actually have on staff 3 bilingual Spanish-speaking family coordinators, and it makes a huge difference. Again, I'm Kiowa. I am not Hispanic. It makes a real difference. Although I have a heart to reach them, I think it makes a difference that Myra's on our team and can speak the language. They can make a connection. Again, with our support, we are a community, but I think it's important that we do have to try to do better where we can, and having on staff those represented race and ethnicities, and in our coalitions as well. I know we participated in the project, and it's the ACL project that was rolled out by, was it Georgetown University? Okay, Georgetown University. I am excited to see that publication. They asked us questions about, have you looked at your census data? Do your coalitions reflect your census data? Are you reaching the family caregivers? And again, that's a data set, credible source. And I could answer it that we are intentional. We try to reach underserved. And I would just challenge each of us to look at that. Our coalitions, to the planning committees, and also our respite programs. Because those family caregivers, again, they need our help. And I just know that we've tried to be intentional. It's not easy. Even with those efforts, we've got to do better. So I would just encourage everyone to just continue, and also look at bringing those family caregivers to the table to learn from them. Nationally, we hear a lot of nothing about us without us. I'd say that's true when it comes to representation of family caregivers. We all have unique journeys, but I would just encourage us to get their voice at the table if it's not already there. But again, I have to attribute it to our team, because they're just as intentional as committed to the underserved family caregivers. And our tribal nations, we work actively to try to partner with them. We do community events to collaborate with them so that we are reaching our Native American family caregivers. And even with that, we still have to do more, because there's so many family caregivers that we're not reaching. But I know together, as we collaborate, we're intentional, we can reach them. But so that's just out of Oklahoma in the short time. I'm sorry.
Oh, that was wonderful. And here's a thought over here.
And yeah, and I just wanted to add, just since and we totally want to hear from you. Talina and I were talking last night about underserved populations, and just share what you said. We were talking about marketing materials.
I was going to hit Aida up. But yeah, and one thing that our coalition and our group is really great about is being intentional in every conversation about representing every person in our marketing material. There is not a conversation, a document that goes out without that conversation, and making sure that it is inclusive and not exclusive. And so I love that we have the ability to have those open conversations.
I would add to that, go ahead and make your way over there, and I'll just add just a little bit. It was unfortunate that Lama Vida couldn't be here this morning, but look for a station like that in your own communities. If you have a radio station of that sort in your community, they want to form partnerships with you. They want you to come on the air and talk about the challenges that you're facing, the challenges that your community is facing. They want to help you solve those problems. If you're doing a fundraiser, they want to help promote that. Whatever you're doing, they want to help you with that. So seek out those radio stations, especially those little niche stations that are going for a very specific community within your overall community.
Tennessee.
Hey, Breon Dixon with Tennessee. I'm the outreach coordinator over here. I had a presentation yesterday. I'm gonna try to stay brief, but what we do, we just make sure we're present, understanding that the caregiver may be working 2 jobs, may be just overwhelmed. So yes, it's cool to do workshops and things that we do, but they just looking at the information and just like, I'm burnt out. We giving them a piece of paper. They're really not taking the information. So what we do, we just go to them. Sometimes outreach looks like being at a farmer's market. It looks like being at, I heard somebody yesterday say a Dollar General, going to their community and doing the uncomfortable, and realizing that outreach is not something that's just dressed up all the time, being able to do the uncomfortable. What else do I want to say? It's a lot. I'm just very passionate about outreach. Swag, always giving swag, let the people be your billboard. Honestly, I love making sure that we have representation of who we're serving on the board or in the staff. That's good because we all have voices, but also stuff like this that we're doing right now, being able to give insight to each other is going to help us to keep going after the community. So that's my time. Thank you.
So I'm going to add that everyone needs a Breon on their staff, right? But more importantly, as I look around this room and see a bunch of middle-aged white women like me, that's an indication that we're not doing the work, right? And it's us with the white privilege who need to speak up and call out the systemic racism in our agencies. Thank you. And say it's a problem that we are sitting in a room filled with mostly white faces because we can't reach the communities that we're sitting here saying we're trying to reach. When my voice does not carry the same weight as Breon's, I can't understand the biases in the same way that the rest of my, or some of the rest of my team can. And so I can't do the work that Breon is out there doing. I can't reach those communities in the same way that he can. And so I think that it's time that we white women who are mostly filling this room stand up and speak out against the problem that's right here.
And lastly, she kind of helped me get another point. Like, I remember first starting outreach, like a lot of the community, they didn't even know what respite was. And that's sad to say, you know, a lot of the community that we served are trying to reach the underserved community. They just don't know what respite is. So we have to educate the communities and do a better job of that. And try to do better job in marketing. I know a lot of people want to do podcasts and things like that, but you got to realize this, a lot of the underserved community, they have their own sources of entertainment. So is that really something that we really want to put all our funding towards? Like, we should do our funding towards the footwork because we have to go to them. But that's all I got to say. Thank you.
Hi, my name is Cheryl Donnell from Nevada. And I had a question. Nevada is one of the states that's participating in the respite training pilot program. And one of the things that we were as a team looking at was our respite workers and finding those respite workers and finding out about the qualities of them, why they are in respite work, and so that we could replicate that. And so I would love to hear from our respite worker up here about what drew her to respite work, how she was matched with a family, how did that go, and also what was more appealing about this position, why she's still doing it. That's what I would like to know.
Great question.
No tengo ninguna necesidad, pero a mí me motivó mucho estos niños que muchas veces el idioma es el que no se puede con otros niños. Entonces, yo la verdad tuve una maestra muy buena, Araceli. Ella, todo el curso es en inglés, ella nos explicó en español, tanto virtual como presente, que es muy importante para nosotros, los que queremos ayudar. Y la verdad estoy muy satisfecha con las clases y muy contenta de poder ayudar a los niños que nos necesiten o la gente que nos necesite.
She doesn't have experience having a loved one with a disability, so the need wasn't something that drove her to become a respite provider. However, she did work as a childcare provider, and that's one of the things that she had on her heart to help those in need. She was very thankful that she was able to take this training in a live setting, not only online, because she was able to learn through experiences from the parents that had a child with a disability. And as she mentioned last, she is willing to continue to help those in need.
The next question that I actually had written down is, what's the biggest challenge that you face in providing respite care to those underserved communities? It sounds like we've already answered that, but is that the biggest challenge? Is it the biggest challenge that we're a room full of middle-aged white women here trying to serve Black and Hispanic, et cetera, communities? Or are there other challenges that you're facing out there?
I just almost tripped in front of a whole room of people. So that did not happen. Oh my God. Here you go.
Thank you. My name is Julie. I work for Lutheran Social Service in Minnesota. One of the challenges that we faced in rural Minnesota is a lot of people don't identify themselves as caregivers. They say, well, that's my mom and dad. Of course I'm going to do the lawn. I'm going to take care of the snow. I'm going to go grocery shopping. I'm going to take them to doctor's appointments. Okay, but that makes you a caregiver. No. I'm being a daughter. Or it's a spouse taking care of a spouse. Oh, of course, that's my husband. Of course, I'm going to give him his pills. Of course, I'm going to make him dinner, supper, breakfast, every day. Of course, I'm going to remind him to do this. That's my spouse. Well, you're a caregiver. No, I'm not a caregiver. And so that's a barrier, is to how do we educate people that if you're providing these services for a loved one or for a neighbor, it makes you a caregiver. And that's a huge barrier for us in rural Minnesota.
Any chance I can pop in real quick in the back here? In Wisconsin, we have the same issue. We have a phone number, and the phone number comes directly to me. And these people have been calling, they've been looking, they've been, trying to find someone, to connect with someone. And what we found is that, I really wish you wouldn't put me on the camera, I'll turn this way and talk. Is that they want to be heard. So if I can be on the phone with them and talk them through, I'm not a caregiver, right? They tell me all the time, and that's okay. You don't have to believe you're a caregiver. That's okay with me. As long as I can help you get to the next step, as long as I can help you move forward and better your life and get a break. That's all that matters to me, is that, we get there.
So just to respond to that too, so in our last cycle of lifespan respite funding, we did a project actually to help people learn to identify as caregivers. So if you go to our website, tnrespite.org, there's a quiz that helps you identify if you're a caregiver or not. And we also have, what kind of video is that called? Those videos that you put on the glasses and you can what's it called? Like a virtual reality video that's like a day in the life of a caregiver. And it's actually like looking around in your house and are these things that I'm doing? Well, that makes you a caregiver. So you could check out our website and we could help you get something similar on your website if you wanted.
Right down here and right there. Right here.
Okay, sorry about that.
And then another one straight back.
We've got about 5 minutes left.
Hi, everyone. I'm Lynn Gall, State of Wisconsin, Department of Health Services. And I just want to add to what they're saying, that this is a very common situation, I think, for everybody. But one of the things that I think that we need to do better on, and there isn't money in our programs for, is to just let people know these services are out there. Whether you're identified as a caregiver or not really doesn't matter, but too often people are waiting until they're in a crisis, and then they start looking, where we just assume you're a government agency or a county agency, whatever. Everybody knows that these things are available, right? Well, they don't. And even though we run them at the state, we run them at the county, at the 80 through the ADRCs, whatever, at the tribe, it's like we just need to educate people that this is out here. It's a part of life. It's lifespan. You're going to have needs of different things throughout your life, and there are services to help you through all those things, and we need to market them and make sure citizens know that they're out there instead of just assuming that they know that they're out there, because they don't know until they're in the middle of a crisis, which is not the time to start learning. So that would be my 2 cents.
There and there.
Hi, my name is Wendy Hangsbach, and I'm from Wisconsin. I'm in Milwaukee, and I've been a nurse for 45 years, and I switched jobs a year ago when Sister Edna Lonergan, who runs 2 intergenerational care centers in Milwaukee, said, "You're a nurse? We need a nurse." And it put me into a discernment. But the points I want to make here, I've been in the job a year. I am a caregiver. My husband has dementia. After I took the job, I had dropped him off in his room, and little did I know that my office with French doors was backing right up where his chair sits. So he can knock on the glass if he needs something from me. But I'm the director of respite. It's a 9-bed unit in Milwaukee, and our challenges, of course, have been staffing, and I finally think I have a really good team. And what I'm doing next is I'm going to ask our student nurses if they want to come work on weekends, because we need still more weekend help. We've got about something like 32 shifts to cover in a week. The other unit is in the very center of the Black community in Wisconsin, and Sister Edna opened that site up, I don't know, maybe 10 years ago. And with COVID, that respite unit, which is I think 11 beds, it's not open because we've been looking for a nurse. So I suggested, well, is there a student nurse that is just super enthusiastic about, working to support caregivers? And right now I have a Sister Immaculate is training to open up the center in a year when she gets her RN degree. So I'm excited about that. So that's where we have in terms of the cultural stuff. Our center in St. Francis is not real far from the Latino community. The other thing, one difficulty I find, I don't know if there's anyone from the VA here today, but we don't have funding for respite for our veterans because our center is not Medicare Medicaid certified. We don't need to do that for respite. So that's a big gap because we've got about 20 veterans that come to daycare, and their spouses don't have that. So those are the points I want to make. And then finally, one more thing is that our students from one of our college, their community project is they're going to have a caregiver workshop day at our center. So I'm excited about that, and we'll be marketing that. So thank you for
sharing. Thank you. Okay, we have time for one more, and then we're going to turn it over to Pat and close because it is 10:06. And honestly, it sounds like by the hands and how much everyone wants to share, we could probably dedicate a week towards this topic.
I just want to say super quickly that at my organization, so I work for the Arizona Caregiver Coalition, which is a nonprofit in Arizona, and what we want to focus on is that early intervention piece about educating caregivers before they're in that crisis mode. And it is really hard for people to identify as family caregiver no matter what their culture is and where they're from, because there is a lot of negative stigma around caregiving of any type, whether you're caring for a child with developmental disabilities or an aging adult. I think even in some federal laws, they say for adult daycare instead of adult day health center or recreation center. So there is just a lot of language and messaging that varies and that adds to that negative stigma, and it's about reducing that stigma first. So we are really working on our own messaging piece, and we have the Arizona Respite Network, which is with some government entities, other nonprofits, where we're trying to figure out what is the right messaging, how do we make this not so negative, and also help with that early intervention piece before a caregiver reaches crisis mode.
Thank you for sharing.
Listening to everyone talk, it sounds like probably the biggest challenge is people realizing that they are caregivers. And one of the things that hit me as you were all talking about that is I think for a lot of folks as they make their way from just average everyday life to being a caregiver, it's a slow process and they don't realize that they've become a caregiver. You know, it starts out, my wife is reminding me to take my pill every day, and then suddenly she's doing a little bit more and a little bit more and a little bit more, and suddenly she's a caregiver, but never realizes that she's never gone to that point. So probably education as to what a caregiver is, and the fact that, as you guys pointed out, it's okay to ask for help if you are a caregiver. You may not even realize that you're a caregiver at this point. You may have slowly become one, and learn what those resources are and where we can turn for help. Again, I would encourage you all to reach out to local radio stations, especially if there's locally owned radio stations in your market, local newspapers. Any local print is going to help you get that word out, or any local media, I should say, is going to help you get that word out, help you with your messaging, help you define what a caregiver is and the resources available to them.
Thank you so much, and I know we ran over on time. I really, honestly, from the bottom of my heart, I cannot thank Padres, Hijos, and Accion enough for what they do in the community. Hector, Araceli, Coney, Araceli, thank you so much for coming. Pat, you rescued us today. I cannot thank you all enough. Thank you. Thank you, thank you, thank you. All right, we're going to have a break. Is this thing on? Yeah.
Yep, you're on.
Is this thing on? We're going to have a break until 10:30, and then everyone can head to their first session. Thank you so much for coming.